European Commission approves Amgen's new cholesterol-lowering medication, Repatha, evolocumab, the first PCSK9 inhibitor to be approved in the world for treatment of high cholesterol. Critical milestone for patients with uncontrolled cholesterol who require additional intensive LDL-C reduction. The European Commission approved Repatha for the treatment of adults with primary hypercholesterolemia, heterozygous familial and non-familial HeFH, or mixed dyslipidemia as an adjunct to diet, in combination with a statin or statin with other lipid-lowering therapies, in patients unable to reach low-density lipoprotein cholesterol, LDL-C goals, with a maximum tolerated dose of a statin, or alone or in combination with other lipid-lowering therapies in patients who are statin intolerant or for whom a statin is contraindicated. The treatment of adults and adolescents aged 12 years and over with homozygous familial hypercholesterolemia, HoFH, in combination with other lipid-lowering therapies. The effect of Repatha on cardiovascular morbidity and mortality has not yet been determined.
We are proud to introduce Repatha as the first approved PCSK9 inhibitor in the world, and that it will be available in the European Union for patients who are unable to achieve their LDL cholesterol goals despite existing therapies. Despite existing therapies, there's still a critical need for additional treatment options to lower LDL cholesterol, or bad cholesterol. Repatha represents, for patients and physicians, a new treatment option to lower cholesterol levels. Repatha is a member of a class of drugs called PCSK9 inhibitors, which when added to existing therapies such as statins can help to reduce LDL or bad cholesterol levels in patients who are struggling to meet their cholesterol goals. Cardiovascular disease and high cholesterol remain a major healthcare burden despite the use of medications such as statins. We're very pleased to offer Repatha for additional cholesterol lowering despite these existing therapies. Patients are at the center of everything we do at Amgen, and the approval of Repatha in the European Union marks a significant step in helping to advance our mission to help to serve patients. The impact of high cholesterol remains a global health burden, and we look forward to working with regulators around the world to make Repatha available to patients.
LDL cholesterol is one of the main risk factors that contributes to cardiovascular disease. As a matter of fact, it has been estimated to be amongst the most important, including also blood pressure and diabetes. Among the patients with high LDL cholesterol that can be detected out there, a number of those are patients carrying genetically increased LDL, named familial hypercholesterolemia patients. Those patients do have a special disease that is marked by the fact that they do have genetics that are controlling their LDL cholesterol and bringing the cholesterol up to levels that are seen as exceedingly high. Patients with familial hypercholesterolemia are difficult to detect and treat because people doesn't look at them. In other words, many general practitioners or also specialists are not aware of that condition. Not being aware of a condition, of course, doesn't allow you to detect those. And this is particularly bad for the patients because those are patients at high risk or very high risk, having had high cholesterol throughout their life. As a member of the European Atherosclerosis Society and the scientific community, the approval in Europe of a PCSK9 inhibitor is a big step forward in the treatment of hypercholesterolemia.